There we go.
I always like to sit in front of the school thing, not in church.
All right, let's see how we do. So wasn't expecting to see you here for this, Brian, but welcome.
Oh, thank you.
All right, and I think we'll get to shed some good light on the fun things we've been playing with this year. So glad you're here.
Okay, great.
Yeah, Melanie,
Hi.
welcome. We're gonna dive in because it's that time. All right, so Brian and I have hung out for a little while, so I'll kind of give you the backdrop on everything here. So, what do you need to know? I've been doing this for about 20 years, and we're going to talk about thyroid. So, have you been diagnosed with thyroid challenges? Or?
I had mine removed.
Removed,
On
okay.
Thyroid.
On Synthroid.
I can't take levo.
Okay.
I have to have bran, but recently I've been having severe exhaustion, fatigue, heat, intolerance to heat.
Okay, sure.
I had some blood work run. My thyroid was fine, but nobody seems to know what the problem is or what they want to do about it.
Okay. So, we'll probably get to shed some light on that for you today.
And
And then, do you have some thyroid things going on now? Let's see. What are your new? Oh, that's all the labs. Look at this. Okay. Okay. All right. Got it. Cool. We're going to talk about some of that all the way here too. Beautiful. So we're going to slow up group. We can really dialogue and have some interaction. So we'll go through the journal and we'll chat as much as you want. Okay. So 3 big secrets we're seeing with healing thyroid, and we'll just jump right in. My family keeps me busy when I'm not here, Melanie. So I got amazing wife Emily and the 6 kiddos, and we're gonna come back. Yeah, we'll come back to the story here in a little minute. But that's my crew from this 2 years ago now. That photo, 2 or 3. Wow. So we're gonna show you how to get 50 to 100% improvement in thyroid function. Yours is now missing, so we'll be right. So, but in terms of the ability to heal, right, you'll see why that is here in a minute. But realizing that's a bit of a bold statement, let's hang in there and show you why we can say that. 20 million people, these are old numbers, but there's a bunch of people dealing with this, and you're not alone. It's one of the most common metabolic challenges in our world, besides diabetes and heart and all that sort of thing. Thyroid's up there. So, traditional treatment options, you just rattle them all off. Basically medication and then they cut it out. Right? That's sort of the trajectory of how that goes, and that's not changed since the 70s. Now, typically, if they're going to remove it, you've had a goiter, you've had some kind of autoimmune, you've had something along those lines, or cancerous, or nothing like that.
they just couldn't get me regulated.
Wow.
Whatever
Okay.
reason, I don't know. So I said, just take it out.
I'm so sorry I didn't get this information to you sooner. They're doing the best they can, but yeah. So okay, that's where we are, right? Thankfully, in the 70s, they found Synthroid, they found levothyroxine, they were able to manufacture that, and that's really helped stabilize a lot of people, but it doesn't actually solve problems. So let's talk about that. Bottom line is they're kind of doing some symptom management stuff. And you probably felt all this, right? Drained, energy's low, you're so busy schedule, but you can't keep it up, right?
Yeah.
Brain fog, yeah, everything's overwhelming, emotions are up and down, right? All this stuff. You just stop, just showing up and stop living. And it's like, so that's the way to exist. So then the question, have you ever wondered, if it's even possible, is it possible to get this back? You know, it's like, why are my labs are normal, my thyroid's normal, why do I still feel crummy? You know, like, what is that puzzle? So the better way came because I never really wanted to treat thyroid. I was like, I'm gonna go learn this in school and be a thyroid expert, right? It's learned through hard knocks, really. And that was my story with this too. And my family. My sister, when I was growing up, had hyperthyroid. And to the point where the eyelids weren't able to close over the eyes anymore. And so she had to have eye surgeries to.
I did have one eye operation.
You got an eye out, so you know exactly what that's like.
Mm-hmm.
And that's like, you know, it's a family, like, that's heartbreaking to see family to go through that. And then similar thing, my mom also has hyperthyroid. And then 6 out of 8 of us in my family have had it. My wife's dad, my father-in-law, was diagnosed in his 20s with autoimmune thyroid. And so that's pretty rare, especially in that generation. And then, so that's been part of her story, right? And then she was a swimmer all through college, and chlorine that does not get along with thyroid very well. And so the toxic exposure for her was a big part of her puzzle. So anyway, she's had her own thyroid challenges. I've had my own at times when my thyroid numbers were low and like don't want to do anything, depressed, you know, even suicidal thoughts at times. Like that's not me. And then our youngest has Down syndrome, which is a population that have high challenges with thyroid. So I've had to live through this and figure some things out and really get some other answers where there weren't any, right? It's like, besides medication and surgery. So, like, well, that's not a good option. Let's have what we can do to get some more deeper resolution. So I'm studying a bunch. They've invited me to speak, different workshops, things like that, and teach some other people what I've gotten to learn. And that's gotten me here to give these giant workshops to our community. But honestly, you know, we don't have the giant budget like Big Pharma does, right? So we just do everything we can to support our locals. And Brian, this might be the newer content that we've been working with here. So conceptually, I had a big paradigm shift in how I think through healthcare, and thanks in part to Dr. Midgley and his influences. And it looks like this, though. So we got physiology is what everybody's trying to regulate. And they can't get you regulated, so they got to do something different, right? So they're going to add chemistry, and that is pretty much the bill that we've been sold. Better health through better chemistry. And that's all the reactions that run your metabolism and organ functions. So medication, vitamins, diet, those sort of things affect the chemistry, and that the whole regulator should improve the physiology. And it's not wrong, but it's incomplete, because the bottom layer, the physics that runs everything on the planet, is light, electrons, and magnets, or magnetism. Right? So the Earth's electromagnetic fields, you know, all the tide, like from the moon, like all these gravitational fields. Like there's a lot of different electromagnetic fields and gravitational fields and all these sort of things on our planet, right? And that has a huge influence on everything globally. Then you add in light from the sun. Every plant needs that, right? And like, so we know that when light hits our skin, we make what vitamin?
D.
Yeah, vitamin D. This is becoming common knowledge. So light impacts, if you travel to a different time zone, right? Your body clock gets off because the light's different. So like it changes hormones. It's a hormone regulator. So light changes all kinds of things. And then electricity, the nervous system runs electrically, and you need electrons to be able to actually manufacture energy in the body. That's how that works. So when we can leverage the physics to improve the chemistry, then physiology has a better shot of running. So that's kind of how we work on the base here. And I guess the other note with that would be just, we'll keep it that simple for now. We can ask questions later if we need to, but that's the basics of it.
Before you,
Yeah.
did anybody ever tell you pyramid is spelled wrong?
Thank you for noticing that. It certainly is. You need a big A in there.
It's a big, I don't know. what it
And
is with
did
it. I
you
can
notice
read
mine
it.
has a capital I? I noticed that one. I just haven't
Well, I
changed the
couldn't
slide.
see that
Oh, couldn't see that one.
but-
Okay. Yeah. No, that's great. Thank you for those details are important. For sure. So to the electron piece, the way we make energy is we take oxygen and we add electrons to that and we make energy. One oxygen molecule gets us 34 energy molecules. It's a pretty good trade-off. Now, when that fails for various reasons, we start to burn sugar and we get 2 energy. Would you rather have 34 or 2? Right? Thankfully, there's a backup system, but that's the ideal and that's the default that we use. Okay, so if you don't have enough electrons, you can't make enough energy. So this creates an energy debt in the system. Okay, so let's think about this. If you are a cell and you're typically making 34, and the body is expecting 34 energy molecules, and for whatever reason you have to shift into the backup system, now you're making 2, how many more cells do you need to make up the deficit? Yeah, a lot, right? So half that you're doing 16, 17 cells to make enough energy. So the first step in any disease process is actually enlargement of the tissue. So in other fields we've got in terms of, so like a fatty liver disease or an enlarged liver, enlarged heart, right? Cardiomegaly, splenomegaly. Like these are organs that get enlarged when they're trying to deal with something. Make sense? So if the battery in every cell in your body is actually a battery, it's got a charge to it. That's one of the reasons we can store electricity and like you scuff your feet and you shock somebody, right? Like there's that right? So those cells have that potential between the membranes actually has a voltage. So if you're running at 100% charge in the battery, you can fix whatever you need to. You've got enough energy in there, you can sort out whatever you need to and make repairs and make new healthy cells. When that starts to break down, now we call that heteroplasmy. There's no test on that, but the bottom line there is now you have to make room for mutations. You can't fix everything. So you have, you do the best you can to repair it, but you're gonna have some holes in the quality control, right?
Mm-hmm.
So from there, when it drains even more, now we get to, so here's what's happening. We don't have enough energy. We're replacing cells. We need to make energy because we're in that energy debt. We're going from 34 to 2. And now we start to create all these new cells. We have a large tissue. So it's like you hired a bunch of new workers. None of them are trained. They don't know what their job is, right? And they're just creating more headaches than they're helping. And they're costing you more than they are worth having on board. So then you kill them off. You fire them. Okay, so that's called autoimmune. So when we're down to this level energetically in terms of the battery being drained, that's when autoimmune can kick in. Okay, that's when your immune system starts attacking the cells in your body. All right. Below that is when cancer is able to develop. So that's a change in how we've been thinking through things in terms of the body is now cancering. It's a verb. It's not, oh, I got cancer. Does that make sense? It's like my battery is depleted to the point where now the last ditch effort, the Hail Mary pass to try to make energy for the body is to develop cancer so you can multiply cells and try to make some energy. It's not trying to kill you. That's the big aha moment. Cancer's not trying to kill you. It's the last ditch effort for the body to make some energy to keep you around longer. It's God's grace to you in that sense, right? Which is crazy to think about. It's a complete shift from how we've been taught in our world. Fight cancer, the battle against cancer, right? It's aggressive language. And I'm not saying you don't need to take it seriously or take aggressive action if that's where your body's at. But you have to understand from a physics standpoint, that's what's going on. The energy is depleted in the tissue, and now it can no longer do its job. So it's going, the last thing I got to do is make a bunch of these things to try to make some energy so we can keep it going. Because what's going to kill you quicker? Let's say it was liver failure or liver cancer. Which one are you going to go out first on?
You think liver cancer?
Yeah, but the failure, like if it shuts down, your lights out. So failure is going to get you every time. If the liver just totally shuts down and fails, now you have no energy. Can't even do that. Make sense? So kidney failure, you get the same idea. Like if the organ just shuts down, it's done working, lights out, right? So yeah, that will kill you quicker than the cancer. And so that's the body's last ditch effort to try to get some energy there to buy you a little more time. Is it fun? I can't say that it is. Thankfully, that's not been my story, but right. So, but that's that. If we think differently about this, get some different solutions and different answers. Does that make sense? So, if your whole health paradigm just got flipped upside down a little bit, good. It was like a real mind mess for me for a little while, but that is what the physics says. So, with that in mind, we'll mention Laura. Now, I'll just give you the brief overview on this one. Laura came in, she had TSH was over 40. And TSH, to remind you of that, and for those that are at home, TSH is, if that's the brain talking to the thyroid, okay? If a 1 on the TSH scale was 1 hormone, a TSH of 2 would be 10 hormones. A TSH of 3 would be 100 hormones. TSH of 4 would be 1,000 hormones. So it's a logarithmic scale for the TSH. But the lab norms are like, depending on the lab, 0.5 to 5. And so if you're within that range, which is a giant difference in the amount of hormone, right, you're in the normal ranges and everything is fine, right? So we know that's not true because too many people feel crummy and they're in that normal range. The way to get the norms is for 80% of the population is the bell curve, and if you're on either side of that, then that's out of range. It is typically out of good. So Laura's was over 40, right, way up there. And her antibody levels, she had autoimmune thyroid, and they were over 1,000. Okay, which means her immune system was really beating that thing up, and her battery was really drained to that point. Through various interventions, a lot of that was even before we had the technology we now have. So, and then she moved out of state, but she got way better. TSH came down to 17, which still is high, but it was a giant improvement from the 40s, and her antibody levels dropped down to just over 100. So major shifts in how her body and physiology were now working. That's the fast version of that and what the numbers stand for me.
What did you say hers was?
It was over 1,000. Her antibody levels were over 1,000.
No, or TSH.
TSH was over 40.
Mine's over 40.
Yeah, over 40.
Okay.
And the range is like the high end is
I just
5.
my patient portal.
Okay, yeah, you're like, where am I at? Yeah. Yeah. So that was a math, and again, remember that logarithmic scale. It's not a line, it's it's a 10x jump every number that's on that scale. So with that in mind, Nancy, her quote, I feel absolutely better. Similar kind of story with that. Today I want to show you root cause, and we kind of talked about that some in terms of energy debt, battery being drained, and then to show you what it looks like for the process we have in place to get things better. So here's a couple big key components. It's impossible to be in a state of healing and stress or crisis at the same time. Right? If the house is on fire, you're not going to go painting bedrooms and rearranging furniture, right? It's crisis time. So here's how this works. The brain talks to the thyroid, or the pituitary, the pituitary talks to the thyroid, makes hormone, and that goes to every cell in your body. trillions of cells you have in your body, every one of them needs thyroid hormone. So there's signaling from the brain. There's nutritional deficits, conversion disruptors, absorption, adaptive inactivation, basically like your safety mechanism, safety valve, and your actual production of the T3, T4 hormones. All of those areas are where something can break down in that process. If they're only giving you a medication, all they're doing is regulating this, which isn't, like I said, it's not bad, but it's incomplete. That's the only thing they're looking at. And to tell you how much you need and don't need, I mean, they might look at T3, T4 numbers and TSH, and you've had a little bit more deeper workup, but generally speaking, they're not really doing much in terms of anything else. So here's where stress will mess everything up. It'll mess up signaling. Right? Your conversion will be affected by stress. Absorption affected by stress. So that also affects your safety valve.
Signaling is spelled wrong.
Is it?
I'm sorry.
No,
They would call me a walking dictionary at work.
But see, these are the details, Melanie, that, yeah, you're going,
Can't help myself.
that's the thing. But that allows you to pinpoint things a lot quicker and go, oh, here's how to resolve that. So it's not a bad thing. Thanks for letting me know that one too. I missed that one. And to be fair, that's not my original slide. So I'm going to have to go back and tell the people man on this. But the big picture here is stress is going to mess you up, right? So the other thing, and that was the other one was affecting your T3. So when we're exposed to a threat, right, or a perceived threat, we're either going to fight it, lean in to fight it, we're going to run away, right, to retreat, or we're going to play dead. Those are our options. And we don't get to pick, it just happens. So if we're in social engagement, we're like, hey, how you doing? What's going on? Conversational, curiosity, all those things. And here, compassion, all those beautiful places we want to be. This is also normal because it's like the little groundhog that pops up, or the prairie dog pops up, looks around. You know, what was that sound? And then goes and plays with his friends and right, they scurry around. So that's all this. Oh, everything's fine, up and down. You hear noise. Oh, what was that? Just a neighbor, you know, that kind of thing. So that's normal. When it gets to be ramped up, then it's like, oh, the neighbor's being too loud, right? That's, I can't stand that, whatever. Then you start getting into irritation, frustration, you're going to rage, or you're going to run away from it if it's too, right? You get the idea, it's going to go this way. So it go from I may do something to I must do something to alleviate this threat. When that goes, that's your sympathetic nervous system. When that goes over to overwhelm, now it's I can't. And that's when the mouse just plays dead and the cat plays around with it and then the cat gets bored and leaves and the mouse runs away, right? So that's the freeze survival mechanism, which is basically just that, survival mode. That's when you feel helpless, trying to conserve energy, all of that, numbness, depression, dissociation, feeling trapped, shut down, hopeless, like all of those dark feelings, right? And I've probably been there a couple of days. Yeah, it's not uncommon.
I've been there for a long time.
The great news is I'm going to show you how you start getting out of that right now. And with the therapies we do here, we see that respond and resolve very, very commonly. So let me show you in that piece, because that's giant. If we can't get you out of this into here, then your healing capacities are limited at best. Does that make sense? So, but that affects everything. Sleep, that affects, you name it, right? That's the big game changer. So, this I have literally invested well over 6 figures learning, and I'm giving it to you for free today, so please use it and give it to your friends and family, okay? So here's how this works. Everybody's got a stressor in life. We've all went through some stuff, and so I want you to think about something that might be a level 4, 5, 6, nothing that's too crazy bonkers, but something that's, bothersome, irritating, and maybe more than just like really is distressing to you, right? And so, do you have something like that come to mind? You can kind of pick one of those fairly easily. Sure you can. You got one right here. As many as you need. Mm-hmm. And so with that, what do you notice in your body when you think about that? Do you notice when I think about what's going on in my world right now in that level, it's probably head and neck. I feel more intense there. I'm more tight in the stomach. Nausea, yeah. My legs feel a little tighter. There's things to notice, right? So kind of do a little body scan, see where you're at. And then the simple correction is going to be you put one hand on the other one and you wrap your fingers on that thumb side of the wrist. Yeah, they're going on like right through here, and here. Yeah, you can get your fingertips on that. That'll be even better for you. Yeah, you got it, Brian. Yeah, just like that. Yeah, and then the other one goes flat on the forehead. Mm-hmm. And then just give yourself permission to feel that feeling, whatever is disturbing you. And it might be more than one, right? It might be scared and angry and what, like, grief, a number of things. And you just breathe gently. And sometimes your body needs to move, right? You need to move that part of the body. So if you need to move, just let your body wiggle it out. And when that feels like it shifts it a little bit, you can switch hands and do the same points on the other wrist. Yeah. Yes, you got it. Mm-hmm. And then forehead. And go back to that feeling. And usually within a minute or two each hand, you're going to feel a shift. It'll lessen, yet the intensity will become less. And when you notice that going down, you can rest the hands down. Yeah. What'd you notice?
There was a decrease in symptoms.
Yeah.
Breathing less nauseous.
Yeah.
Breathing more free.
Great. That's huge.
A little less tightness in the back of the neck.
Nice. Yeah. What'd you notice? Nothing yet? That's okay. Yeah. So using that regularly actually has proven pre and post brain MRIs that show that it works. The research is phenomenal on that. So feel free to read through that. Please use that regularly. And it makes sense in this context. You may not notice much because it's a new environment. All those things, like really getting that feeling, letting yourself feel it is sometimes challenging in a new environment. So that's pretty normal. But yeah, practice that at home. Do that. I recommend it's like brushing your teeth for your emotions. It's like this daily routine of helping to unclog those feelings and help your body process through the physiology so you get out of fight, flight, freeze, into healing, resting, digesting, breathing, and then we're able to move forward in a healing manner, right? So that's that one. This is more reactive in the sense of you've been through something and still distressing. This will help to resolve or calm that down. This one is more proactive, and they're both in your handout there. And this one is more about remembering a time when you felt full of joy, gratitude, just full of thanksgiving, a memory like that. And then picturing your heart in your mind's eye, just picture that area around your heart and pumping that through your entire body, just flooding yourself with that feeling of joy or feeling of gratitude. I think about my wife when she came down the aisle on her wedding day. It's kind of my, just brings a smile on my face. And yeah, just feeling and soaking in that gratitude and that joy. And again, picturing the heart pumping out through the whole body. And there's a couple variations you can use on that as well. So these are both something simple and quick you can do them regularly, do them often, and that's going to help you stay out of that fight, flight, freeze, or when you are in that space, to help you re-regulate a lot quicker. You can do it in a red light. You can do it, mix it in your day wherever you're at. So those are really, really powerful tools. So with that in mind, we see stories like Heidi. These protocols transformed my life. Profound and naturally overwhelming stress and anxiety. You would not recognize this lady today. She has a completely different face, honestly, because of her anxiety levels are different. Her brain's different. So that was a wonderful joy to get to work with Heidi on that. So stress is a big deal. The second main key is inflammation. Not a big surprise if you're, attuned whatsoever to our world. But the idea there is inflammation, we'll call it chronic inflammation, causes all kinds of problems. And we know that's linked to every major illness out there today, right? If you have acute inflammation, sprain an ankle, you want inflammation there to splint the joint and, help you get blood flow to the tissue and all those things that it does to actually engage the healing process. But then you don't want it to stay there, it should go away when it's time. If it doesn't, it's kind of like a sunburn on the inside of the body, and it creates all kinds of pain and issues. What's the top inflammatory trigger?
Stress.
Yeah, so that's a major one. That's why we covered that one first, because the stress will create inflammation out of thin air. Okay? And then we see pathogens. So pathogens in Pennsylvania were number one in the world for which illness, what disease?
Lyme disease.
Yeah, Lyme disease, and it's tick-borne illnesses, tick-borne pathogens. And then you got your junk food, no big surprise there. Chemicals, medications, without saying medications have side effects, they always do. And then heavy metal burdens are another big deal, especially with thyroid. Mercury can be a major player. And like OSHA has all the regulations for mercury, whatever they have to follow to keep people safe. And then the dentist mixes it with some other stuff, puts it in your mouth for decades. And then they change out your filling. And now the metal they just took out, they have to follow all the same OSHA rules over here, but when it's in your mouth, somehow it's safe. That's all I'm going to say about that, but I do know that mercury can cause major problems. So sometimes you need to look into the dental arena to really get good help to remove the poisons that are leaking. I don't recommend that for everybody. You got to do it in the right order, but the bottom line is mercury will not be in your bloodstream. It will go to the bone and the fat. Because if it's in your blood, you're going to get really sick. So it'll tuck it away in the fat, which your brain is mostly made out of fat. And where do the primary organs live that control all your hormones? In the noggin. So heavy metal poisoning can definitely ruin a lot of the hormonal issues going on in the body.
How do you test for that?
Great question. The only surefire way to get accurate levels of metal in the body is cremation. And no one signs up for that. So there are a couple other ways we can measure through secondary excretion, either through urine or hair, are the most commons. And then you can watch patterns evolve as you push metal out. You can see, it started at unable to move metal, which is common. You don't see it high, so everybody, it's not a problem. But then you start doing some metal elimination, and you see it spike up in the hair, and then it'll come back down. The same thing with the urine, as the body's eliminating it. Does that make sense? So you kind of have to watch the excretion pattern more than.
But if you have all of your teeth filled with that, it's never going to.
It's a safe bet that you're leaking some mercury in there somewhere.
Oh, I'm sure I am.
If you have multiple fillings, and especially multiple metals, now you've got galvanic, like literal batteries in there pulling. Yeah. So that can be a big deal. And then chronic dehydration, you need half your body weight in ounces of water daily. Typically, the spring water, which has your electrolytes and other minerals, the other stuff is basically stripped of that by and large. So we can talk a whole workshop just on inflammation, but the big picture here is that we don't calm that down, we get limited results with what we're trying to accomplish in terms of healing. These are the big drains on the energy, on the batteries. Okay, so inflammation will mess up your signaling, conversion. It'll chew up more nutritional items as well, but then it'll also mess with your absorption, your T3, your safety valve, if you will, and more in there. And that'll kind of break the thyroid and all of its function, right? So then we start to remove the inflammation and restore the optimal terrain and the function in there. We get stories like Isabel. Did you ever hear Isabel's story? So that's a fun one, really. She came in, she had type 2 diabetes. She also had neuropathy. And she was very overweight. On her intake paperwork, she said in 1 year to 3 years, she said she would be dead if nothing changed. She's like, I'm not sick. It's just lights out if we don't make shifts. So she went through the program. We did help her with some detox, got her some energy back in her system with light, got inflammation out. Type 2 diabetes went away. This picture is 70 pounds lighter than when she came in. She was in 2 or 3 weeks ago, and it's down at least another 15 pounds. And wonderful French woman, very fun sense of humor. She came in. I was like, Isabel, how you doing? She's like, I'm doing great, doc. Here's a bill. I'm like, what's going on? I thought you were doing great. She's like, well, none of my clothes fit anymore. Not even my underwear. I'm getting an entire new wardrobe, and I'm giving you the bill for it. So that was, we had a good laugh about that one. So completely changed her life from I'm going to die to now my daughter's going to college and I get to be there and keep doing the ministry things she was doing with her church and just has her life back. So that's I don't want to skip over that. That is why we show up to work. That is why when I'm going on 4 hours of sleep, it's like this is what gets me and still keeps me going. People literally get changes that they didn't have hope elsewhere. So now we're going to show what does it look like to actually leverage the technology to actually get some energy back in the system to make changes for what's going on. So, Brian, if you don't mind, we're going to pick on Melanie, ladies first. We're going to get you an opportunity to get some help today. Does that sound like a plan? Yeah, nothing's going to hurt, really. We'll check for tenderness, but nothing's going to hurt. So I'll have you come up here, and here's what we're going to do for a screening. These are common things we see.
Did you say come up?
Yeah, come on up here for me if you don't mind. And
Because I sounded like that last patient.
you sounded like the last one.
Uh-huh.
What do you mean by that?
I have type 2 diabetes,
Oh,
neuropathy, 3 screws in this hip,
uh-huh.
and I had an L4, L5 fusion, some chronic pain.
Yeah. So you're ready for a changeover.
And I'm being treated for this hip again.
Uh-huh.
So.
What's going on?
Yeah.
Yeah. And your thyroid. So it's like,
Yeah.
and so, okay, we're going to check the range of motion. And then Terry's minor muscle is a rotator cuff muscle, and it is it's related to thyroid function. So if the thyroid's off or not functioning well, then we'll see weakness in that rotator cuff muscle. And you'll see this too if you're a people watcher. I noticed that one too. You saw the shoulder. And you'll notice then people with their hands turned backwards, like my dad was a truck driver forever. So like the butt and the hands turned backwards just to close classic
Yeah.
truck driver sort of thing. And so you notice that their hands will turn backwards, but that's a thyroid problem. Because the teres minor does this, and if that inhibits, you're going to see the hands turning backwards. So just a little thing to watch them for people. If it's both, if it's one, it can be a stroke or shoulder, any other thing like that. But if it's both, it's usually hormone thyroid related. And then we're going to see about, remember we said we need oxygen to make energy? We're going to see in real time how many contractions you can do. And you should be able to do over 100 before the muscle fatigues. So that's checking how much your body can actually manufacture energy on the spot in real time. And then we'll check for the congestion, reflexes, and then the rest of the hormone team, brain, pituitary, thyroid, and adrenals. And then your conversion happens in the liver and in the guts. So that's where we're going. And I'll just stand right here for me, facing our amazing audience here. Yeah. And then I'm just going to check range of motion here. So let me know if anything is tight or stiff, or let that go loose here for me, nice and heavy. Go slow through that one. And that moves pretty well. It gets stuck right at the top.
Yeah.
Okay. And this one you had surgery on. Moves fairly well. Yeah, I don't know. We'll see much change on that one. That's doing okay as far as range of motion goes. And sometimes we see that change when we do our treatment. So elbow by the side. You bring the wrist out. Do that on both arms for me here. Yep. And this is that teres minor. It goes right back here.
Okay.
Push the wrist back in my hand. Yeah. And those are not happy yet, right? Now, just to check a different muscle, if you bend the elbow, hold the elbow straight up in my hand, well, that one's also inhibited. So let's choose a different one. Let's go to the other side here. That elbow up might work better. Hold that one strong. It does not. Arm straight there, thumb toward the waist. You're going to keep the elbow straight and just kind of raise it out into my hand. That one works. Keep pushing. Yeah, we got any pain with that?
Not really.
Not really. Okay, good. Yeah, just a little hard to do.
Okay.
Yeah, but that one fires. Like you can feel that one has a little grab to it. The other ones did not. Let's try this one here. I'm pushing out my hand. Yeah, that shoulder needs a lot of support. So we're going to use the right one here. You're okay with that. Now we're going to try 100. All you got to do is just keep your hand there. We'll see what you get. And before we'll do that, I'm going to ask another question. Scale of 1 to 10. How's your energy level now?
2.
2. So it's like 0 is put me in bed, I'm done, and you're just kind of barely hanging
When I
on.
crawl out of bed, I feel like I need to get right back down.
So let's see how many you got here. Hold that up for me here. Turn the thumb to the floor. There you go. Right there. It's perfect. Hold that strong if you can. 1, 2, 3, 4, 5, 6, 7, 20. Yeah, and so this is common. Within 10 contractions, you'll say, oh, my energy's at a 2. We're going to see between 20 and 30. My energy's at a 4. We're going to see between 40 and 50. It's like, it's a real quick litmus test on how that's doing. But that just pans out every time. So yeah, your energy recycling is like 23 out of 100. But you are not making enough energy, girl. You're going to do that. That's why you're here. So the next one is going to be for thyroid congestion. All right, this is like the toilet handle for your thyroid gland, if you would think of it that way. All right, so it'll be tender, typically under the collarbone, about 3 finger widths down is a rib space. And sensitive in there?
A little bit.
Yeah, give me a number on that. I'm not trying to hurt anything. But
About 4.
about a 4. Okay. And it's common when there's thyroid challenges that reflex.
Yeah, that's why it hurts.
Yeah. So what time? That's like a 8 or so?
Yeah.
Yeah, I can feel that's a lot more irritated. So, some irritation with that, some pain with that. We're going to see if that changes that as well. And then our hormone team is in the brain. So the reflex for hypothalamus, that's the one that receives the stress signals. Then that goes to your pituitary gland. That reflex is on the bridge of the nose. And then thyroid is where you would be in the neck. And then the adrenals and liver and guts all walk you through it. This is like a reflex, like when you tap a knee and it kicks. It's a not, you don't think about it, it just happens automatically. This is the same thing on the body. From when we're an embryo, the layer of cells that develops skin and nerve system come from the same layer as embryo. And so from very early on, we've got this connection with skin and nerve system. Okay, so we can use a shoulder like this, hold that one up strong for me here. There we go. And then if we check the hypothalamus reflex, push up for me here, that one weakens. Feel that get tired real quick? If we choose a different spot, like there on your shoulder, doesn't matter. If we check the pituitary, hold that strong here, that's the bridge of the nose, that one also fades, right? So we got brain, which no one's ever checked or worked on, it seems like. And then they went and they couldn't regulate things, so they take the thyroid out. So I imagine when we check the thyroid, it's not going to work too well because it's gone. It's literally gone. So touch on the notch of the neck for me here, and raise that shoulder up again. And so we see that one also fatiguing. And then the conversion of your hormone, the T3/4 conversion, happens in the liver mostly and in the guts. So I can put a hand on the right side of the ribs here. Yeah, that's kind of where the liver hangs out. Push up strong. And we see liver. No, this doesn't tell us that there's disease. It just lets us know, is there a disruption in the neurology and the signaling with those circuits? We say, oh, okay, something's going on in the liver. And then we'll go around the belly button for the intestine. And kind of the palm around the belly button area. Great. And then hold that up strong for me there. And we see digestion might be a factor too. So we have absorption, right? All these different GI things going on that affect conversion, absorption. And then the ability for your hormone, even if you're taking it synthetic, it still needs to get through the digestive system and moves to the other organs. Make sense? So we got this whole team of yours that's saying, oh, I'm a little tired out, or a lot tired out. So now we got our information, and we're going to go to work on getting it better. So Dr. Jeff's going to come over and do the work. I'm going to go through the slides and tell you what's going on, and we'll have a little fun with that. All right? So you have a seat right here.
We'll be up there.
Oh, yeah.
Yeah, I'll come
Have a
to you.
seat in that chair.
I'll come to you.
Could I ask you a question?
Sure you can, Brian.
Just
That was
yesterday, I
another
was
issue I'm
looking for
dealing
a
with
YouTube.
too. I colon and rectal surgery.
This person was saying that the conversion from teeth, well, first of all, it's in the hypothalamus.
You don't have to.
Genes combustion, not only in the thyroid, but all
Is
over.
that comfortable enough?
Okay, and they said that from the T4 to T3, that only about 20% of that conversion is due to the thyroid. The rest of it comes from the liver.
Exactly.
That's just like you were saying.
Yep.
That's the medical profession. First thing they do is either thyroid medication or
Yep.
thyroid surgery,
Yep.
they send through it.
Exactly.
When you could have a perfectly healthy thyroid, because 80% of the problem is down here and not here.
Bingo. Yeah, that's exactly it.
Wow.
Yeah. And then, right, you add in leaky gut, leaky brain, like all these other elements. And the benefit with using technology like this is we can bypass the need for the gut to absorb optimally, because we're literally putting energy directly into the tissue with light, with electrons, which we didn't show you that. I'll bring that out for you guys.
You
have a
want to
micro-
see my patient portal?
Not at the moment.
Okay.
That's beyond what I can get into today, but
Oh, what do you mean, like all my TS?
yeah, I mean, that would probably be a good idea, like for a consult, and we can figure more
Okay.
detail on that. Do you have a microcurrent?
Yeah.
In back there somewhere?
Right.
Awesome.
Should be in the box, right there. So we're just gonna start putting energy right in those reflex points we were working on.
This one, so remember the 3 layers of physics? We got light, which we're using here, and that's really the only one we're using in this context for the demo. This is the microcurrent. This adds electrons, so you can take oxygen, electrons, and then energy, right? We can target where we want that to go with this. We can literally say, oh, it's liver, let's add energy to the liver. Let's add energy to the guts. Let's add energy to the thyroid that's no longer there. Let's add energy to the hypothalamus, to the brain structures that actually govern the production and function of all the other hormones. So we can literally charge up any tissue we want to with this particular technology. These are the applicators for it. And so they're graphite, which means you don't need to keep getting sticky adhesive on you from the little electrode pads. You literally just spray them down with water and just stick them on the skin, and it transmits that way, and you don't feel a thing. If you do, you need more water. That's that's how that works. But everything from we can also do musculoskeletal work on this. So like for a shoulder repair, scar tissue, like I said, we can kind of energize most any tissue in the body with that technology. That's been a real game changer, allowing us to make changes quicker, and with some cases that were just super tricky because you got to do work on the gut, and their gut was so unhealthy, you couldn't make headway, and this allows us to bypass that kind of stuff. So when we're using technology like light, we see antibody levels drop, thyroid tissue regenerates, pain gets better, inflammation calms down. Like, why can all that happen? Why would your T3/4 ratio improve? Like, why does all that happen when we're using light?
What was the question again?
Yeah, everything gets better. And basically, it's like all these amazing things happen when we use laser therapy on and to support the thyroid. Why would that improve if we're using light therapy? We're using light. Ideas on that?
Increasing mitochondrial function.
Yeah, you're literally putting energy, right? The basic physics, we're using light energy to change how the body makes energy. So it literally takes those photons, and that photon energy increases, like Brian said, the mitochondria. That's the energy producing part of the cell. You literally produce more energy with light. And when we use focus light with laser and that sort of thing, we get even better results, because a similar thing, we can actually program the laser. You see some of them blinking, maybe. Like, so I'm blinking. Kind of, sort of.
This one here.
That one's blinking, yeah, that one. So when we blink the light, it actually will target different tissues. So we can change what we're trying to work on. Besides just putting the light on it, we can actually change the signaling to that tissue. Does that make sense?
Mm-hmm.
So it's like, think of like a radio station. You turn on your favorite station, which you're like, oh, that's great, and then it plays your favorite song. You can get that specific with it to target the tissue. So that's light energy. That's electron energy. The other one is the pulse electromagnetic field. That's the chair you're in here, Melanie. The last time I turned on, I blinked my computer, so I'm not going to do that. But this literally recharges. Remember the battery slide we had? It's like when your cell phone dies, you got to charge it back up. You put it on the induction charger. It literally puts energy back into the tissues and recharges the batteries. That's what this technology does. So those are the three main layers we're working on. With thyroid, we've also found vibration gets the lymphatics moving, which is key because your thyroid hormone goes through your lymphatics first and then into your bloodstream. So if the lymph is backed up, you can't actually get the hormone where it needs to be, and the vibration helps that. Other one is detoxification. That's the foot baths you saw over here on the, like, why do they have sinks on the floor? And that's, if you notice over here, you see that? Have you ever seen this before?
Foot detox, yeah.
Okay, so yeah, it pulls junk out of the body, but more importantly, it's flooding the body with electrons and ions, which then allow the body to start to change blood sugar, pH, and get rid of poison a whole lot quicker. So the research on this was they did Roundup exposure, and they found, I think they did 3 a week for a month, and they didn't change diet, anything like that. And then they saw, I don't know what it was, like 4 or 5x the amount of Roundup coming out in the urine just by doing that one therapy. So it really starts to give energy to the body so it can purify better. And each session lasts about 40 to 72 hours, which is another nice benefit of that. So those are big helpers when we're trying to get poisons out and energize the system. And there's the pulse electromagnetic field. Again, all those great things happen, restoring energy, inflammation calms down, hormones get better, and so on and so forth, because we're working with basic layer of physics that energizes the system and allows it to work better. Then we add in the right foods, right? So it's like we got energy now we're adding in food Now we got the right thing, and removing the ones that are harmful, right? So one of the big ones is gluten for thyroid. And another close second would be dairy. So when you add them together, if there's, especially with autoimmune thyroid, dairy and gluten, instead of like 1 and 1 is 2, it's kind of like 1 and 1 is 11. So it's a bigger inflammatory reaction for a lot of people with thyroid challenges. So I mentioned soft wave in here, which is joint repair is a big helper on that one. A lot of people with thyroid challenges, because their body tends to be tired or weaker, are more prone to injuries and other things like that. And this helps to energize that connective tissue and get inflammation down. Wound healing speeds much quicker. And, you know, the Eagles have at least 2 in their locker room. They use it all the time. So, fantastic technology for anything joint related or connective tissue related. My own wife and, you know, brain fog, homeschooling a bunch of kiddos, trying to keep it all together, and just hooked on sugar and caffeine just to make it go. And it would energize her more. When the brain fog lifted for her, I knew she was brilliant and amazing. And then, like, when that changed, I'm like, who is this woman? These amazing thoughts and ideas, and like, it was just a whole nother. It was beautiful to see that. So we've lived this personally in our own story. And, you know, we have ups and downs like everybody else, but we got tools now to go and support and energize along the way. So, let's see how we did. What are you noticing?
It was lighter or something.
Lighter. I love that. Yeah.
Behind you here. All right. Let's put the shoes back on.
Thank you, Doc.
You're welcome.
So lighter's fantastic. Come on up, we're gonna check those same things here again. Is your energy any different than a 2?
Yeah. Maybe.
Yeah?
A 3 or 4.
A 3 or 4.
Yeah.
So 50 to 100% improvement.
Yeah.
That's good. Well, I mean, to be honest though, at this time of day we're at 5 almost. What energy level do you typically have at 5 or so in the
Crash and only couch.
Like it's not even a 2, it's lower than that. So the fact that it at least didn't go down and it's probably up a little bit is a big shift for you, huh?
Yeah.
Wow, that's really cool. Yeah. Let's see what happened in the rest of the system here.
Okay.
And we'll go back to our range of motion. This one was stuck a little bit. Let that relax here. It's stuck a lot. Heard that clunk.
I did.
Look at that range of
Yeah,
motion
right
now.
there.
At the very top it hurts now.
Mhm.
But before that, you were sticking like
Yeah.
about here.
Yeah.
Now we're moving way better. That's pretty cool. Let's check that teres minor and the elbow for me. You're gonna bring the wrist backwards on both. Yeah, pushing the wrist backwards. And that's, what do you notice there?
It
It didn't move, right?
Yeah.
That's really cool.
Mm-hmm.
Now let's check. I'm just wondering on this other shoulder. We had several muscles weak over here. Then the elbow. Can you raise that up to the ceiling up in my hand now? That one's still inhibited.
Yeah.
Elbow straight. You're gonna push into my hand. I'm gonna go to the waist.
Okay.
That one's better though.
Mm-hmm.
Yeah. So that's curious. Just see what those are like. Done. Now let's check those sore spots.
Yeah, it's still there.
Still there?
Mm-hmm.
4 still?
Yeah.
Yeah. Okay. When did they take your thyroid down? How long has that been?
I really don't know. It's been a while.
Long, like decades.
No,
No?
I'd have to look back. I honestly don't know. I've had so many procedures.
Yeah, it'll get muddy in there. Okay. So it's different than an 8.
Yeah. Yeah.
When you notice that you're not jumping.
No.
Similar to the other side now, or better than
Yeah.
that, or similar?
Mm-hmm.
That's pretty fun. So again, that pain relief,
Yeah.
right? And we did no medications there, right? So that's pretty fun. And then your hormone routine, you ready? Arms straight for me here. We'll check that hypothalamus pushing up for me here. Go and grab the bridge of the nose for the pituitary. Hold that one up strong. That's sturdier. Let's go to the neck there. Hold that up strong. No, that makes sense that it's not, but it's still weak because it's literally not there.
Yeah,
Yep, remember, you got it. Hold that strong for me here. That one still needs some help. We didn't get all the way with that. Right. Let's go to the belly button. Hold that one strong. And so we got a little more energy in that one. So we still see liver and thyroid. We didn't, it's been there a minute. And that's the other great thing too is with this, we can see did we actually make headway or were the gaps still in the support? And we see it in real time.
Yeah.
So that's the benefit of what we get to do in using these kind of tools. So the fact that your energy's up, that's my favorite part because you're going, I feel a little better than when I came in, which is fabulous. You can have a seat there, Melanie. Thanks for.
Could I make a comment?
Yeah, please.
As just an observer.
Yeah.
In your face, there was more of a relaxed lightness, radiance. When you first got up there, you were smiling, but you were smiling through the tension.
Yeah.
Where here, it was just,
Yeah.
I noticed that just.
Thank you for noticing.
Thanks, Brian. That's a powerful observation. Yeah. So, gonna wrap it up here. We got two options, right? Keep doing what you've been doing, or let's use something that's actually making changes in real time, right? So those are what that looks like. So here's what next steps look like and common questions we get. How do I know if I qualify? We do our own assessment, right, like anybody else. We're going to figure out, although let me say it's not like anybody else, we're going to do our assessment, but our assessment is totally different than most everybody else because we're able to look at things differently and ask different questions because we're looking at different answers. If the only answer I had was, thyroid medication or surgery, those are my only answers, right? That's all I've been taught, but we got way more information and tools to support people with. So, but if you have had labs, bring those in. All that information is great. We can help sort through that and see what's necessary. The assessment takes roughly an hour. And then healing times are going to vary depending on what's going on, right? If the thyroid's literally no longer there, that's going to be a little longer than maybe.
Like forever?
Yeah, right. So yeah, I mean, you get the idea, like, yeah, there's going to be gaps that need supporting because it's literally gone. But if we can support the other structures and allow your body to regulate better with the hormone capabilities it does have, we can still make more headway than just relying on the medication alone for support, right? Does that make sense? So, and healing times are going to vary. That's the bottom line there. Insurance coverage, what do you think?
Probably not.
Yeah, unfortunately for the technology, no. They may cover some things for office visits, but even that's going to be somewhat minimal in my experience, and which then leads to like what would investment be for health? And a lot of it depends on what the goals are, right? If we're trying to regrow a thyroid no longer there, that's a different that I have not yet seen that. I'm not going to say it's impossible, but I've not yet seen that. But that being said, it ranges, right? So if the goal is we're going to feel a little better, a little more energy, that's different than I want to be as healthy as I possibly can be and really go, for the long haul for me and my family. Those can be different conversations, right? The short answer to the long question is basically it's going to range. So ranges typically for equipment, and that's the other thing. These would be things typically that either you rented or owned at a home, which is then giving you the ability to treat between visits. We don't need, we make more headway between visits. Does that make sense? So with that in mind, rentals and or ownership, you're in the range of probably $4,000 and can go up from there. for equipment, depending on what you would need and how much of it, and so on and so forth. Okay. So that's probably the low end starting point for a technology package and some visits to get things regulated. And different ways we have to help you with that in terms of payment programs, things like that that are available. So, promise to you though is this: if we can't help you, we're going to make sure we get you in the hands of somebody that can. But from what we can see already, we're making some head with just some light. Like, that's a pretty good shot. And then the process looks like this. We have a 2-day process. We have an information day, and then we have our report day. And so the information day, we do our consult, and we do our neurological thyroid exam, where we check all the vitals, all the basic things. We do our neurological exam. We can find out if you're in fight, flight, and freeze, and go through heart variability testing, all the things we look for in that exam.
What's a trauma pattern?
That is how we assess if you're in fight, flight, or freeze. So again, if you're in fight, then your flexors are turned on, right? And the extensors will be inhibited, and that won't fire properly neurologically. You might also be dodging, so it can be side bending. So we have flexion, extension, side bending, and we'll see if neurologically you're in, if those muscles are firing properly to keep you balanced in those positions. So it's easier to show that.
Balance is off.
Right. So if you have neuropathy, for example, that might skew what we're finding. We can also check it laying down. So we've got ways to look at that, but the trauma patterns are the way the body adapts to traumas and stresses, whether it's been surgical, emotional, whatever. How did the nerve system respond to that and adapt? And there's 8 different patterns we look for to see if they're regulating properly. Okay, so that's what that would be. So the goal is all 8 patterns are cleared out and firing properly neurologically so that your nerve system has bandwidth to be in a healing state. Okay. Heart rate variability looks like a pulse ox on your finger, but it gives us a report like this. And in this context, I want to see your stress score be low and your autonomic balance in the middle. That means you've got decent bandwidth to play on either side. And we need to make sure your circulation, especially if there's neuropathy, we need that to be down at a 1. If you're a 5 or higher, that's when cardiology typically gets involved, and we need to make sure your heart's okay. So that's what we look for in that screening. And yeah, that one should be in the middle. And then it kind of looks like that when we do our testing for the fight, flight, freeze. And there's other patterns to look for, but that's a quick example. Those are the trauma patterns. Go through all the information, all your labs, see if we need to order anything more, whatever. We put that information together and go, what's the plan? And here's the equipment you might need, so on and so forth. Go over that plan with you. Anybody else that's on your healthcare team, really good idea to have them on board because you get way more, especially if you're brain fog. It's always great to have somebody else helping you take notes and keep track of things. So we go over all that information, financial options for you on that second visit. And everything together is $875 for both visits, which I'd like to think is a bargain because I had a thyroid ultrasound done for my own thyroid, and one test with no doctor visit, just ordering my own. It was about $1,000 for one test. So to get 2 visits, and I think we're offering a good value with that. But I realize insurance isn't going to pick this up. So the other thing I want to do is give you some gifts. Give you an energy boost treatment. You already had one, but now if you choose to go forward, we'll get you another one. It may be more of a foot bath or something different to experience that. And we're going to get you 25 anti-inflammatory recipes that you can start using for thyroid. Okay? And those are gifts we want to get into your hands. Altogether, value is $945 for spending a beautiful Tuesday afternoon with us. So we're going to do that for $197 for both visits. I want this to be a no-brainer. figure out if we can help what needs to happen next and get you some good help. Okay? So, with that in mind, we had a couple of spots reserved for this workshop. If that makes sense, move forward on that one. Just go check in with the ladies. It will get you the first available and get that going for those at home that want to do that as well. Basically until the end of the week, we can extend this. And actually, can we do that? Whatever. Whenever those spots are gone, they're gone. I don't know how many that is.
Can I take a picture of that?
Sure
so
can.
overall's included?
Yep.
Thanks. That'll give me. Okay, thanks.
Good?
Yep.
So, yeah, how to claim your spot. Check in at the desk. We'll get your information. Collect the payment for that tonight to hold your spot. Get you the paperwork you would need for that and get you rolling. So that's simple. Other questions? I'll be here hanging out for a moment or two, and then I got to go help my own kiddos. So thanks for being here. Did you learn something valuable? Was that some eye-opening stuff? Some new concepts we haven't really chatted about before? Beautiful. Yeah, and I've done my job. Hope to see you soon. And until next time,
Thank you.
good evening.
Sounds like you've been here before, but I'm.
Yeah, but it was for a different problem.
Oh, okay.
Mm-hmm. And if you're at home and interested, it's 717-285-0001. Have a great night, everybody.
Thank you.